Welcome to the OhioHealth Survivorship video lecture series. Today we're going to talk about the OhioHealth MindBody and Oncology Counseling Program. I'm Lora Hanna, and I am trained as a clinical social worker and certified as a hypnotherapist and interactive guided imagery facilitator. And I've been providing MindBody Services at OhioHealth's Integrative Care at the Bing Cancer Center since 2012. So MindBody Services include several things, including counseling for cancer patients, caregivers, and survivors, guided imagery and hypnosis, as well as a variety of relaxation techniques. So Oncology Counseling Services, we provide a place to discuss your feelings about your cancer journey and challenges that you face. We also address feelings about changes in your body, changes in your identity, career, lifestyle, family, etc. as a result of cancer. We can address your fear of recurrence for cancer survivors. We can address anxiety related to cancer and treatment. And if it's appropriate, we can include family members or caregivers if desired. So what is guided imagery? Guided imagery is like a purposeful daydream that can be used to create a positive impact on your mental and physical health. Imagery is a direct and powerful means of communication between your mind and your body. Your body can respond very powerfully to images in a way that it might not respond to just words. For example, if I asked you right now to salivate, you may or may not notice anything happening in your body. But if I ask you to close your eyes and you think about biting into a tart lemon, feeling that lemon juice squirting through your mouth and the tart, sour taste of the lemon juice, you might notice some action in your salivary glands. And it is that use of the imagery that is very powerful. And imagery can give. Sorry, I gotta.
That's fine.
Should I just continue?
Yeah, just write it imagery is fine.
Okay. So imagery can affect many of the body's systems, including heart rate, blood pressure, digestive system, immune system, and this is what makes it a very, very powerful modality. And we can use guided imagery for many positive purposes, including reducing anxiety, stimulating your immune system. Guided imagery can also be very helpful for preparing you for a successful surgery, successful chemotherapy, and radiation treatment. In other ways, guided imagery can help to connect you to your problem-solving abilities and creativity. It can also help move you towards positive goals, including moving you towards wellness, weight loss, stop smoking, many positive personal goals. So I'm often asked, what is the difference between guided imagery and hypnosis? And I often use the two together, but technically there are some differences, so I wanted to explain the term hypnosis. And hypnosis is a very powerful state of mind which can be used to enhance the effects of guided imagery and can also be used on its own to help you make positive changes in your mental and physical health. And the four components of hypnosis are, number one, an altered emotional state, usually deeply relaxed. Number two is selectively focused attention, which you're very focused on generally the words that are being spoken. Your critical mind is relaxed and you are open to positive suggestion. So with these 4 factors in mind, it becomes a very, very powerful state for learning and incorporating new information. It is a very natural state of mind. It is something that we go in and out of on probably a daily basis. Something that many people can relate to would be the idea of highway hypnosis. Perhaps you've been driving on the highway and you're so involved in imagining your last wonderful vacation that you drive by your exit maybe 5 miles and you realize, I was so busy thinking about my vacation that I passed my exit 5 miles ago. And that's an example of just being in that altered, highly focused state. And many people can relate to that. And using hypnosis for hypnotherapy is creating that state deliberately so that we can use it for positive purpose. Common uses for hypnosis include things like weight loss, pain management, stress management, smoking cessation. And as I said, I generally will use those 2 techniques together, hypnosis and guided imagery, and they do work very synergistically together. I'm also work with teaching people how to use these techniques on their own. We'll often make recordings for people so that they continue to work with their guided imagery and their hypnosis at home to help enhance their forward movement. In addition to those 2, I will work with folks on a variety of relaxation techniques, and these may include various breathing techniques and some sensory enhanced yoga techniques. For more information on the OhioHealth MindBody and Oncology Counseling Program, please call Cancer Call at the below numbers.